Hello, my name is Rhonda Jordan. I'm a registered nurse in the state of Ohio, and this is my Capstone project for Mercy College of Northwest Ohio. I'm completing my BSN completion program. This is my project. The title is The Vulnerable Population of the Developmentally Delayed or Disabled, what we formerly know as MRDD. My overall goal for this project was to teach nurses how to communicate with these individuals, whether by words or action. So that's going to go into assessment, how to interact with these individuals, and then change in our communication. I added on here the federal law that was enacted. It was began by former President Ronald Reagan in 1986 and then completed and signed into law in 1990 by former President George W. Bush. And it's called the Developmental Disabilities Act. I've added it on here, and it tells you what qualifies someone to be developmentally disabled or delayed. And then we'll go on to the physical assessment, the do's and don'ts. Interacting with this individual is a little different than your normal patient. Let the patient advocate for themselves. They are individuals, they are adults, and they can answer questions just like anyone else, most of them anyway. They do have caregivers that take care of them, usually 23 to 24 hours a day, depending on their functional and cognitive ability. And so they can answer for themselves. Never make assumptions about the patient's disability. Just simply ask them, you use a wheelchair, how do you get in and out of bed? You use a slide board, do you need help? And just offer assistance when they need it. Offer assistance with a disability, and only give them assistance if they ask. If they're visually impaired, when you walk into the room, identify yourself and anyone with you. If you have a patient care tech with you, say, hi, this is Amanda. She's going to be taking care of you, taking you to the bathroom, helping you with your meals, whatever you may need. If the patient is of shorter stature, maybe they're in a wheelchair or they're just smaller in stature, get down to their level, speak to them eye to eye, and just give them that respect. Don't be parentalistic. What that means is don't treat them as a child. They may have the mentality of a child, but try not to treat them as a child. And, ask them about their abilities. They are the expert. They live with this every day. We may know what the textbook says, but until you actually deal with a patient with this type of disability or any type of disability, they are the best teachers. So just ask them. And then the assessment. Be mindful that many of these individuals, is why I call them the vulnerable population, are physically, sexually, mentally, emotionally, financially abused. A good example of a sexually abused individual I had was a patient that came in. She's 56 years old. She recently, within the last 2 years, was placed in a group home because she lived with her father, who cared for her for the majority of her life. Come to find out that she was sexually abused by him, which she knew no different because she was, cognitively delayed. And so she presented with confusion, combativeness, fever, so forth, complaining that it hurt when she voided. Come to find out she had a UTI, but she still would not let anyone look into her private areas or her genitalia. So I kind of taught the nurse and myself to think outside the box. Okay, we got to be a little smarter than this situation, but we need to assess her. You touch her blankets, she would pull them up. She wouldn't let you look. So we asked her if she wanted to take a shower. So we got her in the shower, and she did not give it two thoughts. Got undressed, got in the shower, and we were able to assess her area at that point. We were able to update the doctors, infectious disease, and her treatment team to better care for her. So that's a little bit of an example of thinking outside the box. If a family or caregiver is present, a lot of times they want to answer questions for the individual. That's okay if the individual can't answer the questions, but give the individual that respect and say, is it okay that mom answers this question for you, or your caregiver's here and your caregiver says this, is that true? And just give them that kind of respect. Do not complete their sentences for them. Nurses have a really good way of doing that. We're in a hurry, we want to rush, and so forth. Consider using short answer questions and give them time to think about it. Some of them have to think a little longer to answer. So you just got to be patient. We'll move on to communication. Communication is essential when you're dealing with these individuals. It builds trust between the patient and the nurse, and that's in every aspect of nursing. whether verbal or nonverbal, it's imperative that we get all the vital information, and that if we don't know, we ask those that may know, maybe caregivers or whatever. We're going to move on to what's called person-first language. This is kind of a new area in this area of disabilities. Places the person before the disability. So it puts the person first before the disability. That's critical. It describes what a person has, not who the person is. An example is, how many times have you come in and they say the guy in 25 is MRDD? Okay, well that kind of gives us, we understand that. That makes sense to us. But we don't say the guy in 5 is hypertension and the girl in 12, she's diabetic, she's, MS. That's not how we really communicate. So things kind of need to change. It helps eliminate those old, discriminatory, prejudice, hurtful descriptors. Because if it was your child or even you and you heard somebody outside your room saying this patient's MRDD or this patient's retarded, that could really, kind of lose that trust between you and that patient. And this moves us all in a new direction of better communication and communicating better in this field. Person-first language is not political correctness. Instead, it demonstrates good manners, the good old golden rule. And if we see this person in this way, they will see themselves in a better way. I've added a graph on here, and I have it labeled say and replace with. How many times do you hear MRDD, mentally retarded? That should not be said anymore. The best way to say that is say cognitive disability. Instead of saying handicap, special needs, disabled, say older adult with disabilities, or this patient has disabilities. Instead of saying she's handicapped, say she has cerebral palsy, say she has MS, say she's got cognitive disabilities. Basically what you're seeing is disability descriptors are simply medical diagnoses. That's all it is. It's saying what it is. Instead of saying someone's wheelchair bound, you just say she uses a wheelchair. Instead of saying normal, healthy people, say people without disabilities. Instead of saying she's nonverbal, say she communicates, with a device. She communicates with her eyes or hands. She writes. These are just some examples of what we need to change in our language and communication. What I'd also like to add at this point is medication administration. It's very important to understand that these individuals living in group homes, living in homes with 1 or 2, 3 adults, and they have caregivers. These caregivers are certified by the state of Ohio or any state they live in to have medications given to them. So these people, these caregivers, are given meds just like you and I do in the hospital. They have MARS, they have meds, they have to know the 5 patient rights, and they are given these meds. A good example of a med error in this situation was an individual was saying he had constipation or diarrhea when he was actually constipated because he did not know the difference in the terms. So we were treating him for constipation, vice versa. He ended up with a bowel obstruction and a colostomy because he was obstructed and he had constipation, not diarrhea. So that's a good example of caregivers, if they would have simply said, save your stool, let me see it in the toilet. But, many of these are also, they're paid minimum wage. So just be aware of that they're non-licensed adult caregivers passive medications. So that's critical. So that kind of concludes my presentation. I do have a couple little pictures on here. I have a little Down syndrome boy. He says, like if you pledge to end the R word, which is retarded. And then it also, Hippocrates says it's more important to know what sort of person has a disease than it is to know what sort of person or what sort of disease a person has. So that concludes my presentation. Thank you. What you said.